Now, from ABC4 News, coronavirus preparation versus panic.
Thank you for joining us tonight for this special presentation, Coronavirus Preparation versus Panic. I'm Brittany Johnson. As coronavirus cases do go up, so does the unemployment rate. 6.6 million Americans filed for unemployment over the past week. 10% of the U.S. labor force is now out of work. Between March 29th to April 4th, more than 33,000 Utahns filed for unemployment, issuing almost $7 million paid in benefits. And to answer questions about filing for unemployment, I'm joined now by Kevin Burt, the Unemployment Insurance Division Director for the Utah Department of Workforce Services, who joins us now via Zoom. Hi, Kevin.
Hi, how are you?
Great, thank you. Thank you for joining us for such an important topic here. We do want to begin with unemployment insurance and how that's changed due to coronavirus-related orders and legislation.
Well, it's changed dramatically, mostly because of demand. So in 2019, we averaged about 1,100 claims a week. And then last week, the most recent data released was we received 33,000 applications, so over a 2,800% increase. So it's definitely a demand, and it's because this COVID-19 pandemic has impacted so many people's employment, and so unemployment is the option to them to help them feel some economic relief.
Wow, that is such an enormous influx right there of unemployment claims. How is DWS adapting to all of this?
Well, that's a good question. We certainly weren't at the staffing level necessary. 2019, we had historic low claim volume because the economy was doing so well. And this happened almost overnight. In the first 16 days of the pandemic, we actually received more applications for unemployment than we did all of calendar year 2019. Now, one way we've been able to do that is Unemployment Insurance Division is a division within a larger department. And so we've looked at some resources across the department that may not be really familiar with unemployment, but have a basic understanding. We pulled them in to be able to perform some of the functions. So what we want to do is make sure that we meet this demand and provide this benefit to individuals. The other thing we've been doing is we've really been proactively communicating to claimants. We want to make sure that claimants file online. You take the time to make sure that you complete that application completely. And remember, unemployment insurance is week to week. So every week, an individual has to log on again, the same place that they filed their claim, and attest to their situation, if it's changed or if it remains the same. And then the other thing we've communicated, unemployment is different than most benefits. There's not a need to call us. If we have questions about your claim, we will call you. So we're trying to strike that balance of providing answers that people are calling about without jeopardizing the actual processing of that benefit so individuals can get the economic relief they need.
Now, this can be a pretty daunting task. Can you quickly walk us through the unemployment filing process?
And so you go to jobs.utah.gov and you apply on benefits, and then you can kind of walk through and it says just file a claim or apply for benefits. And then a person just kind of goes through it. And what they'll need is their social security number, they'll need their driver's license number, and then what they'll want is about they'll want to know the employer as listed on their check stub. So during the application process, they'll be given information about, hey, we have as a department that you worked for this company. And then you just match it up and that'll help us make the monetary decision. And then so once they do that, again, there's not a need to call us after that. Our processing timeframes are normally about 21 days. Because of this demand, we're communicating about 21 to 30 days. But they need to understand that once it's processed, it will go retroactive to the date that you are eligible. And so it's just a matter of filing online, and then at the same time, every week, it's 4 to 5 questions, where they basically say, hey, are you working? If you did work, how much did you get paid? And it's just attesting to your current situation, and that'll trigger the benefit moving forward.
Now, there's a lot of questions about who can actually file for unemployment these days. Now, we've received questions like this one from our viewers. I'm self-employed and had to close up at the salon I work at. Can I file for unemployment? Give us some insight there.
So unemployment insurance is a tax paid by employers for covered employees. And so there is this group of the working population that is self-employed. And the self-employed do not pay taxes in unemployment, so they're historically not eligible for unemployment benefits. So for the self-employed that have only been self-employed, it's not the right time to apply. Now with the CARES Act, there's a new program called Pandemic Unemployment Assistance. And it is a benefit for those not normally eligible for your traditional unemployment benefit. And it is 100% federally funded, and it is a federal program, but it would be administered by the Department of Workforce Services. Now, it is a new program we've never administered before, and so we have to stand it up from scratch, meaning stand it up the application and the processing end to be able to get to payment. Now, the good news is we've been working very proactively to try and get this up, and we believe that we will have the application ready this week so that individuals who find themselves in this situation like this call or like this question that you just read off, they would be eligible to apply for pandemic unemployment assistance, which would give them that benefit to help them when they've been impacted by the pandemic as well.
All right, thank you for joining us, Kevin Burt with the Utah Department of Workforce Services.
Thank you.
Coming up, the new travel declaration from roadways to airplanes. We are answering your questions about the state's travel orders.
You're watching Coronavirus Preparation versus Panic.
And we are back answering more of your coronavirus questions tonight. One of our viewers wanted to know the following. If we live in Salt Lake County but own a home in Washington County, are we able to travel to our second home and stay there for a few days? Governor Gary Herbert addressed this at one of his daily briefings.
Travel should be eliminated unless it's essential. If people think somehow that they can well leave their primary residence here on the Wasatch Front and go on to a vacation home or a hotel in southern Utah, you're not interpreting our directives correctly. This requires you, if you're on your way down I-15 right now and can hear my voice, I'd ask you to turn around and come home. We, again, need to stay safe by staying home. That's the best place, and we're going to have to all adhere to that counsel and do the best we can. And I know it's tough. I know it's not easy.
Meanwhile, the Utah Division of Emergency Management canceled the state's travel declaration alert system at 12:17 this afternoon. Now, this comes after 600 people reported receiving phone alerts all by mistake. The system did go into effect last Friday to send notices to the cell phones of travelers entering Utah, asking that they fill out an online health declaration. Officials say most of the false alerts were reported by people living in the St. George and Vernal areas. That's near Utah's southern and eastern border.
We do feel very bad about that because that is not the intent. The coronavirus is really kind of a strange time that we're all going through right now. We are asking for as much patience as people can muster.
8,000 people who traveled into the state by vehicle or plane filled out the online health form. Now, the alert program was scheduled to continue through May 1st. The state will continue to ask people to fill out that travel declaration, but now that alert will just be on electronic road signs. In a statement today, the Utah Division of Emergency Management looked to the future, saying, quote, "We look forward to continued conversations with our federal partners and the wireless carriers as we work toward more precise alerting in the future. In the meantime, the technology is still available for Amber Alerts and other emergency messages that may need to be sent to wider areas of the state." And the state will continue to ask airline passengers at Salt Lake City International Airport to fill out the health declaration form. The travelers arriving at Terminal 1 and 2 will be greeted by UDOT officers handing out these postcards. On the postcards, there's a QR code that grants access to the declaration form. Travelers we spoke to said they would fill out the form.
You know, I appreciate everybody's efforts in trying to keep the general public safe.
Yeah, I'll do it. We travel weekly, so it's no big deal.
The state is asking all passengers 18 years old and older to fill out that declaration form, but the state is not enforcing it. Coming up, essential workers have had to adapt to these trying times and work under strange conditions. How postal workers are helping keep us all safe.
You're watching Coronavirus Preparation versus Panic.
ABC4 is answering your question about the COVID-19 coronavirus. Many of you want to know how long the virus can survive on certain surfaces and if you should be concerned about packages you receive in the mail. For that, ABC4's Jordan Verdadero met with U.S. postal workers to find out how they are adapting to the pandemic.
You might want to walk up to your mailman and grab your mail, but during this coronavirus pandemic, you might want to be cautious and think otherwise. Going from home to home is a daily routine for mail carrier Russell Lovell. He says if someone is outside, usually they want to interact with him, but just like you, he's trying to stay safe during this crisis.
For your safety and our safety, just stay with the guidelines of, about the 6 feet. Let us deliver the mail, come in after us.
The United States Postal Service is busier now due to the COVID-19 pandemic, according to the postmaster in Roy. Signs on the door instruct customers to stand 6 feet apart from one another, and there are marks on the ground.
Our clerks in the front office are certainly at the most risk and contacting with the public. So we ask that even as they hand the package to our sales and service associate, that they do step back and adhere to that 6-foot guideline.
Scientists say COVID-19 could live for 24 hours on cardboard and live in the air up to 3 hours and on certain surfaces for several days. There is no evidence the virus is being spread through mail and packages, but the post office is still taking precautions. Workers are given gloves, masks, and sanitizers and are encouraged to use them, but it hasn't become mandatory yet, according to USPS leaders.
They're driving around touching somewhere between 600 and 800 mailbox lids.
Mail carriers are encouraged to spray down their vehicles before and after their shift, but they aren't disinfecting your mail. The United States Postal Service is looking for people to hire during the pandemic, so if you have lost your job or you are looking for an opportunity, make sure to go to USPS.com. In Roy, I'm Jordan Verdadero for ABC4 News.
Now, we have also received several questions about coronavirus like this one. How long can the virus live on clothing? I work construction and wonder if the mud I get on me that everyone walks on can infect my clothes, gloves, etc. We reached out to the Salt Lake County Health Department to help us answer this question.
So first of all, it's important to remember that the greatest transmission risk for COVID-19 is the respiratory droplets from an infected person. So if you stay out of range of respiratory droplets from another person, you're not going to be at any significant risk. Now, we know from studies about respiratory droplets that they only travel up to 6 feet from the human producing them. So that's the most important thing to remember. You stay 6 feet away from other people, their respiratory droplets that may or may not have COVID-19 in them cannot reach you. Now back to the question. Clothing specifically, we don't know how long COVID-19 might survive on clothing, but we don't consider it a significant transmission risk. If someone in your household has COVID-19, you should handle their clothing a little bit differently than you would normal laundry. You want to wear gloves when dealing with the infected person's clothing. You want to wash that clothing, and you can do it with other laundry. It doesn't have to be separately, but you want to wash that laundry with the warmest water setting appropriate for the fabrics. When you're done with the laundry, putting it in the washing machine, you can take the gloves off and then wash your hands.
Tonight, we are also shining a light on the people who keep things clean for our healthcare workers so they can do their job safely. ABC4's Jason Nguyen takes us into the University of Utah Health Hospital and shows us how hospital cleaners use a special machine to keep all of the rooms sanitized.
Making sure hospitals are a clean and safe environment is a demanding job.
But now we have COVID-19. We are paying more attention than before.
James Mwiziwa is the EVS discharge team supervisor at the University of Utah Health Hospital. He's in charge of 45 people who clean it.
There were a lot of panic. Many people were scared. It's a virus that is taking lives of people.
He says he was scared too, so they met with doctors, learning how COVID-19 was transmitted.
Right after those approaches, we were able to build confidence to our staff.
Covered in personal protective equipment, they clean patient rooms like these that have the COVID-19 virus.
Right after, we bring that special machine that goes inside to kill all viruses.
The machine is called a rapid disinfector and sanitizes everything the UV light touches.
We are happy and proud of what we are doing to prevent this spread of COVID-19.
It's an essential role in the battle of COVID-19. I'm Jason Nguyen in Murray, ABC4 News.
As we continue to answer your questions about the coronavirus, many viewers are wondering about the most effective ways to protect themselves and their families. Like this question: I have heard that hand sanitizer has to have a certain amount of alcohol, but I've heard others say they don't need any alcohol. If they do have to have it to destroy the virus germ, how high of a percentage? Once again, we took this question to the Salt Lake County Health Department.
First of all, hand washing is better than hand sanitizer. When you wash your hands, you are physically removing those particles from your hands. They're not just dead or deactivated. They're physically gone and washed down the drain. So that is the best thing you can do. Now, if hand washing is not available to you, hand sanitizer is an acceptable second choice. And to be effective against COVID-19, that hand sanitizer needs to be at least 60% alcohol.
In the long term, what we worry about is if these symptoms get worse instead of better, then it could actually turn into a disorder rather than just symptoms.
Coming up, we are all searching for ways to cope with the stress caused by the pandemic, how to manage our mental health in the long term. That's next.
With the massive impact of COVID-19, we visited the Salt Lake County Health Department for the proper and effective way to wash your hands.
Okay, so I'm going to contaminate myself. So, start by wetting your hands, getting them soaked, and you want to lather first, palms together. And you do the backs of your hands, and then interlace your fingers with palms together to get between your fingernails, or between your fingers. And then you clasp your hands like this and rub back and forth, and that kind of gets the backs of your fingers as well as your fingernails. And do the other side. And you want to make sure you get your thumbs. It's kind of a circular motion around your thumbs, other thumb. And then the palms of your hands, you do the fingertips around the palm in a circular motion. Get your fingertips nice and clean. And the other hand. And then my wrists. And that was 7 different steps. And if you do those 7 different steps for about 3 seconds each, you're going to get your 20 seconds of wash. And then I rinse it off and use my paper towel. Just the basic things of keeping yourself healthy. And those are the ways that you can help reduce your risk of getting sick and risk of passing on illnesses to others.
Curtis Booker, ABC4.com.
You're watching Coronavirus Preparation versus Panic.
As we all take more precautions to stop the spread of COVID-19, the CDC now says we should all be wearing masks in public places like grocery stores or pharmacies. The CDC recommends simple face coverings like cloth masks or scarves. People who have contracted the virus but do not have symptoms yet can still spread the disease. Medical-grade protective gear is not necessary and should be saved for medical personnel on the front lines. Right now, we are all trying to balance social distancing with the need to keep in touch with our friends and loved ones. That has led to questions like this one. I am 70 and my husband is 72. We have no underlying health conditions. Is it safe for us to stay in our car and talk to our children while they are on their lawn over 6 feet away from the car? Our visits are usually less than 20 minutes.
Yes, that is a perfectly safe way to find some family time together without putting yourselves at risk. Again, since we know that the virus is primarily transmitted through respiratory droplets from an infected person, and respiratory droplets only travel up to 6 feet away, as long as you're staying 6 feet away and you're in that car by yourselves with household members, there is no problem with socializing through an open car window as long as the other people are at least 6 feet away from you.
Social distancing, isolation, quarantine, job loss, the stress caused both directly and indirectly by the pandemic can take a toll on our mental health. ABC4's Nicole Newman spoke with a professional about how to properly address your symptoms.
In dealing with an illness where unity is the best prescription for defeating it, many of us are actively alone together as our best defense in stopping the spread of COVID-19.
There's lots of self-help platforms available to help manage situational anxiety and depression.
But all of that alone time paired with the financial and emotional stress of this pandemic is enough to make it a serious burden. Dr. Corey Erickson is a family practice physician in Fruit Heights.
What I think is missing is care for those whose symptoms have progressed beyond the expected reaction to the situation to an actual disorder.
To tell the difference, Dr. Erickson says you have to monitor your symptoms to see if they're just short-term or become long-term. He also addresses potential thoughts of suicide.
Symptoms of depression, and one of those symptoms can be days where you just don't even want to be here, you don't want to be alive.
Dr. Erickson encourages people to reach out on the Safe Utah app as well as mooddoctor.com to get a free mental health assessment. In the newsroom, Nicole Newman, ABC4 News.
Well, in this age of social distancing, we've all had to get kind of creative with how we celebrate our special occasions. For one Salt Lake City boy's birthday, his friends hosted a drive-by birthday party. Like everyone missing out on these traditional birthday celebrations, 11-year-old Michael Bahati and his friends and family had to make some adjustments. Michael's friends showed up on Friday with these handmade signs and honked their horns to wish him the best.
She said I was in trouble and my teacher was coming because I didn't get my homework. It was mostly like the best surprise birthday.
We know and understand that these are very difficult times for everybody, and for all the families who came here to show support to Michael, we really appreciate it.
Hopefully this gives you some idea of how to celebrate your special occasions in your life while still social distancing. Well, that does do it for us tonight on this special edition of ABC4 News, Coronavirus Preparation versus Panic. As we learn more about this, go to abc4.com.